So you or a loved one may have been diagnosed with a fecal impaction. You could be wondering, what the heck is going on? What happened? And what do I need to do? In today's video, I'm going to explain exactly what is a fecal impaction. We'll discuss the symptoms of this. We'll discuss the causes of this. We'll discuss some of the treatments and preventions. And at the very end of the video, I'll explain when you need to see a doctor for a fecal impaction. Guys, let's talk about this. How y'all, Dr. Islam here, aka your poop guru and gut microbiome expert. I'm a board certified gastroenterologist trained at the Mayo Clinic. I've treated thousands of patients with gut issues for over 10 years. Come see us up at Gastro for all your GI needs. So what exactly is a fecal impaction? This is literally when you have a large piece of stool that is stuck in the colon, typically the rectum. And because of that, nothing will pass through that. It's a big old ball, a big old boulder that is in your colon. And because of that, things back up behind that boulder. Now, how do you know if you have this? Well, obviously, if you're not using the restroom and nothing comes out, there's an excellent chance you have that fecal impaction going on. And typically this is in individuals that already have issues with constipation. So if you're already having constipation, all of a sudden things are not going anymore, then you may have a fecal impaction. Now, because things pile up right where that stool is at, you can have other symptoms associated with this. Nausea, vomiting, not feeling good. But not only that, you can still have stools despite that. How does that happen? So you have this ball that's there. And even though this ball is plugging things up, you can have stool seepage kind of come through that area. So despite having a fecal impaction, you can still have bowel movements from that. But you also have other symptoms from straining like rectal bleeding, hemorrhoids and fissures, and things like that. So what are causes? We talked about being constipated as the most common cause, but usually it's constipation in someone who is older or who may have other neurological issues. So in my practice, I commonly see fecal impaction on those individuals that have problems like Alzheimer's, Parkinson's, stroke history, because there's something neurologically going on that prevents the normal contraction of the colon. And on top of that, they may have constipation with that as well. And that combination can make it harder for things to pass through. But diet can also play a role. So not having a high fiber diet that typically averages between 25 and 40 grams of fiber per day can make it harder to use the restroom. This is the same thing when it comes to constipation, but it can be worse in those individuals that are already constipated or older as well. Other causes include some of the medical conditions I talked about. So for example, Alzheimer's and Parkinson's and strokes. These are neurological disorders that not only can affect the bowels, but also affects the lifestyle changes that normally can cause constipation to get worse. So for example, if you have Alzheimer's or you've had a stroke, you may not be as mobile as other individuals. You're not moving around. The lack of mobility will make it harder for you to pass a stool. You may not drink enough water, and so being dehydrated can make it more likely for you to pass your stool. Those medications that treat Alzheimer's or Parkinson's or even strokes, the side effects of those medications can also slow down your bowels as well to make it more likely for you to have a fecal impaction. Other disorders including chronic kidney disease, spinal cord injuries, and thyroid disease, especially hypothyroidism, that can also be a trigger when it comes to fecal impaction. But the most common cause, besides being older, are medications. Medications notoriously have a constipation side effect. In fact, I bet you, if you look at the side effects of any medication that you're on, constipation is on there. But especially if you're older, those medications that you take when you're older tend to be a lot more and have a lot more constipation side effects. So the common ones include anticholinergics, anticonvulsants or anti-seizure medications, antacids that contain aluminum or calcium, anti-diarrhea medications, blood pressure medications like calcium channel blockers, diuretics to help you pee, iron supplementation, and the biggest one of them all, opiates. Yes, opiate-induced constipation is a very, very, very common cause of why things don't pass through all the way. It's also a very common cause why people are impacted in their colon. So if you have this in combination with an older individual, in combination with somebody who already has Parkinson's or a neurological issue, that is setting that person up to have a fecal impaction, which will lead to consequences down the road. So what can you do and how can you prevent it? So here are my recommendations. So number one, staying hydrated as much as you can is going to help stools to pass through. And so the more hydration you can have, that's going to allow the lubricant to go down, to allow things to pass a lot easier and to prevent that impaction from occurring. Number 2, making sure you increase your fiber intake. So fiber is the foundation for gut health, but also it can loosen up your stools, break open that impaction, and make it easier to go. Number 3, daily Miralax is safe to use. Let me stress that one more time. Daily Miralax is safe to use. So many patients are scared of taking Miralax every single day. I don't know why. There's some sort of wife cell that's out there that says you cannot be on daily Miralax. You can. It's okay. And so if you need to do it, that should not be a problem. Having some sort of physical activity is critically important. We know the more sedentary you are, the more difficult it's going to be for you to use the restroom. So even if you're walking, that's enough to get things going and flowing. If you have an acute fecal impaction, sometimes we actually need to manually disimpact the rectum. And yes, I've had to do this for my patients. The stool is so tight and so big in there, I had to use my finger to just dig that stool out. It's yes, it is what it is, but that's okay because that's what we do as doctors to get you feeling better. And you may need to do that. Sometimes using enemas can help out as well to flush that colon out to get the stool out as well. And sometimes in rare instances, we actually may need to use a colonoscopy or even use surgery to remove that impacted area because we cannot get it out no matter what. So when do you need to see a healthcare provider about your bowel issues, especially a fecal impaction? Well, number one is that if you start to notice a new change in your bowels, so you're getting constipated, but all of a sudden you're getting worsening constipation, especially if you're having pain, discomfort, and things are not coming out. Number 2, you've not had consistent bowel movements in a couple of days or even a couple of weeks. And if this is normal for you, that's fine. But if it's a change from that, if it's more prolonged and more pronounced, then you need to see a healthcare provider. Number 3, you have severe abdominal pain or bloating. That could be the sign of things backing up and cause you to have those symptoms. Number 4, you've noticed rectal bleeding. That's not normal, and don't ignore that. Or number 5, you start to notice you have pencil-thin stools. This could be a sign you could be having a fecal obstruction as well. I hope these tips were helpful for you. Let me know in the comments down below. Do you have any other recommendations that you've tried when it comes to bowel issues? Comment down below. I would love to hear what you guys have to say. Thank you for watching. Don't forget to smash that like button, like, share, and subscribe. If you want more information, come see us at Lipa Gastro for all your GI needs.